Jean. Hello, my name is Sarah. I'm the nurse taking care of you today. Can you just state your name and your date of birth for me, please? We have Casey Banks. Casey Banks. Date of birth 10/2/1965. All right, date of birth 10/2/1965. And do you have any allergies, Casey? Casey says they're allergic to aspirin. I see that on the wristband and on the MAR. All right, Casey, so the reason why I'm here today is I'm bringing in that ibuprofen and also that Alternagel. So both of those will help you feel a little bit better. Do you have any pain right now? On a scale of 0 to 10, 0 being no pain and 10 being the worst pain ever. And Casey says that they're having about a 7 out of 10 leg pain right now. It's achy, dull, and just on one side from when they fell. All right, Casey, I'm sorry to hear that you're having pain. I do have that ibuprofen with me that the doctor has ordered. That should help relieve your pain. It's an anti-inflammatory medication. And then I remember you saying too that you were having a bit of an upset stomach as well. Is that correct? Casey says, yeah, he still has a little bit of upset stomach. It's just some indigestion and reflux happening. All right, so I have some Alternagel that's going to help coat your stomach, help act as a buffer and neutralize some of that acid that you're having, which could be leading to some of your symptoms, okay? So before I get started with our medications, I'm just going to do my last medication check just to verify everything, all right? Okay, so I have Casey Banks, 10/2/1965, allergy to aspirin. Today we are giving the ibuprofen, and I have ibuprofen and ibuprofen, oral route. I have an oral tablet and another oral tablet, BID, dose of 400 milligrams. I have 200 milligrams and 200 milligrams for a total of 400. Do it 0900. It has not been given today for the 0900 due time, and you already verified the expiration date, but again, this does not contain aspirin in it. So Marcheck 3 is done for my ibuprofen, and I'm gonna pop those into our pill cup here. Okay, there's 1 and 2. Okay, then I'm going to do Marcheck 3 for the Alternagel. So starting over again, we have Casey Banks, 10/2/1965, allergy to aspirin. We're giving Alternagel aluminum hydroxide, and I have Alternagel aluminum hydroxide, concentration 600 milligrams per 5 mLs, and I have 600 milligrams per 5 mLs oral suspension. We're giving 15 mLs orally. This was oral solution, and we did pour out 15 mL, so I'm going to look at this at eye level. And I do have 15 mLs of liquid that's poured. Every 4 hours is needed for indigestion, which our patient has, and it has not been given today within the last 4 hours. Yep, so that's already poured. It did not contain aspirin. So I'm going to do my hand hygiene again. Casey, I'm going to sit you up a little bit more so that you can swallow this medication safely. Do you have any trouble swallowing medications at all? And Casey says, nope, they have no trouble. So the first thing I'm going to do is give you the pills. Would you like to hold them, or do you want me to put them in your mouth for you? Casey says, I can put them in her mouth, so I'll do that. And I also have some water to help the pills go down. Okay, so I'm just going to assess that you can swallow. Take a sip of water. Yep, no difficulty swallowing. All right, here are those 2 ibuprofen tablets here. So he takes the pills. We're going to swallow some water. All right, any trouble with those going down? And Casey says nope, and I'm going to have you open your mouth and stick out your tongue. I'm just verifying that you swallowed your pills, and the pills did get consumed. So that is done. I'm just going to document that we administered that medication. So 1/4/23, 0900, SB. And then we're going to do that Alternagel. So this is a liquid. It's going to taste a little bit chalky. We will not give any water after this, otherwise it dilutes the medication and makes it less effective. So I'm going to have you drink this. Okay, so Casey's going to drink that liquid. It's all gone. There's no coughing or anything like that after taking the medication. So we're going to date, time, and initial here. So 1/4/23, 0900, SB. All right, I'm gonna do my hand hygiene again. Casey, I'm gonna come back in about an hour to reassess your symptoms. It usually takes around that time for that pain medication to start kicking in, and then for the alternate gel to help with that indigestion feeling. So I'm gonna leave you sitting up for now, but I'll come back, like I said, in an hour. I'm gonna make sure you have your call light, side rails are up, and the bed is in lowest position. So I will see you later, Casey. Then I will clean up my supplies. If I didn't document already, I would do that now before I leave the room.